Hello viewers, whenever there is low sperm count, people and when they get diagnosed with varicocele, people ask me, doctor, whether I should get surgery or should I go for IUI? This is an interesting question, interesting and important question. See, now IUI is a temporary procedure, but if both husband and wife, if they are having problem, then getting IUI is easier option. But if you have varicocele, in varicocele sometimes sperm quality may be low and sperm DNA fragmentation may be on the higher side. When quality is on the lower side and DNA fragmentation is on the higher side, then what happens is the success rate of IUI or the success rate of IVF both will be on the lower side. Suppose normal in general IUI success rate is around 15 to 20%. But when there is severe varicocele and high DNA fragmentation index, the success rate is less than 10%. So now if you compare cost to cost, so now each IUI procedure will cost you anywhere between 15 to 25,000. And we say at least 3 IUI cycles should be done before planning IVF. So if you do 3 IUI cycles, then you will end up spending almost anywhere between 75,000 to 90,000 inclusive of all scans, medications. But if first IUI or second IUI is successful, then it's a good news. But if all 3 IUIs fail, then instead of going for surgery, instead of going for IVF, it's better to do surgery. When you compare IUI, natural pregnancy and IVF and surgery, IUI is less expensive than surgery. But what happens is you try 1 or 2 cycles. If 2 cycles fail, then you think of surgery. But if you compare with IVF and surgery, it's better to go for varicocele surgery, then wait for the sperm quality to improve. That will improve the success rate of IUI or IVF. So we see some patients, sometimes we see patients with 3 failed IUI cycles. We do varicocele surgery. Then either they get natural pregnancy or their sperm quality improves and they go for IUI again. Very rarely people will go for IVF after varicocele surgery. So when you compare varicocele surgery or IUI, what we suggest is, if there is no female factor, surgery is best. If there is female factor, that means even the female partner is having some problem, then go for 1 or 2 cycles of IUI. If 2 IUI cycles there is failure, then go for varicocele surgery. After varicocele surgery, your sperm count will improve, your sperm quality will improve, sperm DNA damage will come down, which indirectly or directly it improves pregnancy rate, whether it can be natural pregnancy or through IUI. So when it comes to IUI or varicocele surgery, my suggestion is, if severe grade varicocele, no female problem, varicocele surgery. If female problem is there, then go try IUI, 1 or 2 IUI cycles. If it fails, come for varicocele surgery.